My name is Dr. Ian Storch. I'm a board-certified gastroenterologist and osteopathic physician, and you are listening to D.O. or Do Not. If you are interested in joining our team or have suggestions or comments, please contact us at doordonotpodcast.com. Share our link with your friends and like us on Apple Podcasts, Facebook, Twitter, and Instagram. We hope you enjoy this episode.
Dr. Jeremy Polman D.O. is a third-year internal medicine resident and aspiring gastroenterologist in Baton Rouge, Louisiana. Dr. Polman attended medical school at Lincoln Memorial University-DeBusk College of Osteopathic Medicine and completed his internal medicine residency at Baton Rouge General. He's passionate about teaching and has even worked for an online education company throughout his residency that helps thousands of DO and MD students prepare for both the USMLE and the COMLEX. He also recently published a book, Osteopathic Medicine, A Core Concepts Approach, to further simplify learning the osteopathic principles. Tune in today to listen to Dr. Polman's path to osteopathic medicine and all that he has contributed to the osteopathic profession so far.
Jeremy, thank you so much for being with us tonight.
Happy to be here. Thank you for the invite.
Yeah, we're excited. A couple of our pre-meds love your book. So the main reason, there's a lot of things we're going to talk about, but the main reason why we wanted to have you on is because you wrote a book for online med ed on osteopathic manipulation.
Yes, sir. That's right.
Now, just a brief, we don't work for online med ed. We're not endorsing online med ed, but I know that a lot of medical students love online med ed. So can you first tell us what online med ed is and what they do?
Online Med Ed is an online medical education company. We help provide additional resources for students to use in order to learn the material that they need to learn throughout medical school and for taking their board exams like USMLE Step 1, 2, and 3, and also now COMLEX Level 1, 2, and 3.
Can you just give me an idea? Let's say, I haven't done this in a long time. Just if I was going to take the boards, whether it was the DO boards or the MD boards, what are sort of your options for study resources for these tests?
Well, if you're trying to study for, say, the USMLE or COMLEX or any of the exams that you take during medical school, usually people will stick with lectures that they get during their medical school, or they'll do question banks that are either provided by their medical school, or they'll find stuff online such as UWorld, Quizlet. Anki also has some other learning resources as well. There's a lot of other commercialized products that do very well with review material, like Doctors in Training is one. And basically they just provide extra information and not necessarily help you learn the information the first time. The way that online med ed is a little bit different is it's not only a review platform, but it's also an educational platform, to where a student or a learner, when they're first learning the material in medical school, they can watch these videos and read these notes to help augment their learning, to help digest it a little bit easier and make a little bit more sense. And then on top of that, there is a question bank and written notes and all the traditional things that people think of when they start studying. So it's the sort of thing where instead of just only having a review source, it's also a learning source.
Sounds amazing. And the students that I spoke to, again, I'm a little far away from this, and obviously this was not around when I was studying for the boards, but the question that I have, it sounds like it's very inexpensive for students. So do you have any idea how online med ed generates revenue?
Sure. So one of the great things about online med ed, and I think the reason why most medical students use the product, is all the videos that go over hematology, GI, cardio, anything that you can think of. All the videos are provided in a lecture format for free, and anybody can go online and watch them. If you're a free user, which means that you just create a username, you're able to access the videos, but you have to go through an ad first. So there would be some sort of ad revenue that way. But if you like the product and you want to get the full service, which Online Med Ed has, that includes a premium subscription. But on top of the videos, you also get written notes that go along with each lecture. You get flashcards that go along with each lecture, and also a question bank that goes along with each lecture. They're also integrated in a scheduler program that they have online that mixes and matches what you need to learn for which courses you're taking. And it also helps kick back up old information that you've already studied, say a few days or a few weeks ago, to help keep it fresh in your mind. So that when it comes crunch time before your exams, you're not just scrambling trying to remember everything from the past. It's pretty unique compared to other things that are out there.
All right. So sounds awesome. Again, I know a lot of the students that are on the podcast team use it, and they all say that it's great. All seems pretty reasonable as far as cost goes. Obviously, you're an expert and you wrote this book on osteopathic medicine for the boards. Can you tell me a little bit about the difference and what DO students really need to know and how the idea for the book came about?
Yeah, so the main difference between the USMLE and the COMLEX is that the USMLE obviously does not have DO content on it. So they don't cover osteopathic medicine. The COMLEX, written by the MBOME, does have osteopathic medicine. The difference that kind of trips people up is that when you think of traditional coursework, cardio, GI, respiratory, whatever, they're nice and divided out into little slots. So when you're taking the USMLE, you might have a cardio question or a renal question or something like that. It's not exactly like that for the COMLEX because they not only have a specific subset for osteopathic specific questions, such as treatment styles or diagnostic technique or things like that, but they also have OMM littered throughout the rest of the questions. So you may be asked a GI question, but maybe a pertinent physical exam is missing. And instead of having that, you have an osteopathic finding. So if you're not fully in tune with osteopathic medicine, it's not like when you take the COMLEX, you can just take the hit and not get the OMM questions right, because you're actually going to end up missing a whole lot more, because most questions on the COMLEX do have some sort of OMM component ingrained in it. So the idea behind the book was to teach more students about osteopathic medicine. One of the difficult things when you're a DO student is that you learn all the same information that MDs do, but you also learn osteopathic medicine. So it's like drinking water from a fire hydrant, but you also add in the extra coursework, right? So sometimes that kind of slips through the cracks. And ultimately, because the way that the COMLEX is written, it really hurts students to try and get a residency spot that they want in the future. So the idea that I came up with when I was one of the teaching fellows at my medical school was, how do I make osteopathic medicine a little bit easier for learners so that they can digest the information and have it make sense, so that when they do get to the point where they're taking step 1 or level 1, level 2, that they end up getting a score that they want. They do a little bit better on the exam.
So you wrote a book. And what is the title of the book?
The book title is Osteopathic Medicine, A Core Concepts Approach.
Okay. What are the other options? So let's say somebody didn't have access to your book, or maybe before your book was published. What are the other choices that students have to study for this part of the boards?
So that's another great question. So when I was in medical school, there were not a whole bunch of osteopathic sources. I think that that's one of the reasons why DO students maybe let OMM fall through the cracks a little bit when they're studying for their other coursework, just because it's too difficult to find a good resource to learn OMM. So instead of spending an hour with first aid or whatever other resource you have, instead you're spending 45 minutes trying to Google for a Quizlet or some PowerPoint notes from lecture that don't necessarily make sense. And you end up spending more time just trying to find a resource instead of actually studying the material. So one of the goals with what I did with Online MedEd is to create one place that has all the information that you need, so that you don't have to start jumping around to different review sources. Things that were available when I was a medical student were things like the Green Book or Savarese, Quizlet, online, just Googling random, other people's study guides, basically. I would say that there is a big difference between the product that we have and other things that are out there. I think other things are just very good review sources. They're great notes that somebody took during their time when they took the course in medical school. But ours is more of a learner based. So if you're an MD, or if you're a day 1 DO student and you have no idea anything osteopathic related at all, The idea behind this book is to walk you through everything osteopathic and help teach you the core concepts so that you can actually understand what you're learning and have it make a whole lot more sense, and not necessarily just provide you with lists of facts to memorize with everything that goes along.
Now, what I think is awesome about the book too, and you sent me a copy of the book, I was able to review it. I think it looks great. If someone was, say, a pre-medical student and they're thinking about osteopathic school, and it's a little bit difficult to really understand what the actual manipulative therapy is. And I remember when I was thinking about osteopathic school and I was looking at, some of the old textbooks and looking at sort of these static pictures of people doing high velocity thrusting techniques, or it looked like they were just like twisting the person as a pretzel. Like you can't tell what's going on. But your book actually has links to videos showing the techniques, right?
Correct. So in the book, we do focus more on OMM, so the osteopathic manipulative medicine. But in order to kind of hammer home some of these core concepts, we do have select OMT, or osteopathic manipulative treatment. And each one of those, when we do call it out, has specific steps. It has an artist illustration that goes along step by step for what each motion is. And then you're exactly right. There is a video that comes with it. There's a QR code that's beside the treatment. You can scan it with your phone, and it takes you directly to the video page that you can watch me performing the treatment on somebody else. And it has overlays with what position that you're moving or what muscle you're attempting to activate. And it goes along really well with the steps that are in the book. So it's very convenient for you to be able to read it, look at the picture and have it all stagnated out. And then if you want to see it actually being done, then there is a video that you can go to.
It's amazing. Now, Jeremy, just taking a step back, are you like the OMM guru? You're like the OMM god? Like how did you, first of all, become interested in the book? How did online med ed find you? And how did this whole project come together?
So I certainly wouldn't say that I'm a guru with OMM, even though I think that I do know a little bit more than maybe some other people. I'm just an osteopathic physician who enjoys being an osteopathic physician and enjoys having this extra tool in the tool belt that I can use on patients and help improve, whatever ailment they end up coming to the clinic or coming to the hospital with. So I first got involved with this when I was in medical school. As I was saying earlier, first and second year, you're drowning with all the extra material that you have to learn. And I'm trying to learn OMM on top of it. And it was very difficult. And I felt like there must have been a completely different way of being able to approach the concepts and try and get this to stick in my brain a little bit better. So I came up with this idea of core concepts, which means instead of memorizing hundreds of different treatment styles and hundreds of different manipulations and hundreds of different facts, instead, you can boil OMM down to memorizing these core concepts. And once that you get those down, then you can apply it to the rest of everything else. And everything just starts to make sense at that point, or at least it did for me. So at the end of my second year, my medical school actually offered a teaching fellowship position where they took 7 of us and we spent an extra year on campus. We helped teach the first and second years OMM as well as anatomy. We also helped write the exams, write the lectures, do the lab practicals, basically join faculty at that point. And over that year, I kind of used my core concept idea and I helped tutor some students and I got some really positive feedback and I felt like I really made a difference in some of these students' exam scores. So then once I left, third year was going and I was doing my core rotations, but I was also studying for step 2 or level 2 with the COMLEX. And I, just like most other people, I used online med ed, but I realized that they didn't have any OMM content on there. And that was something that I was having to Google and try and find something else to learn from. So I reached out to them and said that, I did a teaching fellowship. I came up with this idea. Other people seem to really like it. I think that I can provide something that may help other people. And they were very gracious. And they said, yeah, give it a shot. Since then, it's just grown to this large project that has almost 30 videos that are online on their website. And I think it's something like 60 or 70 written notes. There's a couple hundred questions. And then the book just came out with it on top of it. And the feedback so far has just been incredibly positive from everybody. It's kind of overwhelming, to be honest, but it's something that I enjoy doing, and it's something that I enjoy teaching. And ultimately, I think the goal is to help first and second year students score better on their board exams, obviously, but also if I can get a DO to continue to use some OMM in the future, then I think that's pretty cool too.
The story is awesome. I think the book is awesome. I think the project is awesome. And again, I feel like online med ed is really a staple for a lot of medical students at this point. So I think the fact that you were able to bring osteopathic manipulative therapy and bring the COMLEX into online med ed, I think it's great. I think you did. The book is great. Like, I love the book. I'm going on vacation next week. I think I'm going to spend a little more time perusing the book. The book is really just well put together, really nice. It's a beautiful book. You really did a great job, Jeremy.
Well, thank you. I appreciate it. It was definitely a huge team effort. You know, I've never done anything like this before. So my portion was to come up with the material and how to organize it. But there were also tons of illustrators that they found that are these professional medical illustrators that came up with these fantastic illustrations that you just can't find anywhere else. And we had a fantastic editing team, and just getting the cover design and the page layout and everything else. There was an army of people behind it. So it was a team effort. And I think you're exactly right. The whole team nailed it.
And I have to say, I think you're a inspiration to students in that the fact that you were a baby doc and really interested in this and had passion and saw value, you didn't say, look, I can't do this because I haven't been practicing manipulation for the last 30 years. You kind of just picked up the torch and said, look, I'm a student and I think I know how to teach this to other students. You took the value that you got from that teaching year that you did and put it into a product that I think is going to help a lot of students in the future. I think you deserve huge accolades for that.
I think it'll help a ton of people too. I'm very happy that other people have used it so far. And I still get emails every couple of days saying like, oh, Dr. Polman, thank you so much. You have no idea how much better I felt about taking the COMLEX. So it's pretty rewarding, to say the least.
Jeremy, I want to take a step back now and just hear about your personal journey. So can you tell us when you decided you want to go to medical school, when you decided you want to be a doctor, where you went to college, and how you ultimately ended up in osteopathic school and where you went?
So I first got interested in medicine when I was in high school. I went to a private high school in Middle Tennessee where all of my friends had parents that were either doctors or dentists or something like that. I'd always liked science. I'd always liked puzzles. And I would always like talking to people and trying to figure stuff out. And ultimately, it just kind of clicked. And I got it in my head that, I think this is maybe the route that I want to go down. And I think around that time, too, Dr. House came out on TV, and that was the show that I was obsessed with. Same with everybody else. So I think that kind of solidified my idea. I ended up going to the University of Tennessee at Knoxville for my undergraduate, and I really loved my time up there. I had a couple of experiences during college that kind of solidified my want to go to medical school and ultimately maybe even my career goals as well. I had a roommate who ended up getting very sick one day, and he had this, questionable belly pain, something or another, and he never went to the doctor until one day he was late for class, and we ended up having to go and look at where he was, and turns out he was syncopized on the ground. Took him to the emergency department, and turns out he had undiagnosed Crohn's disease for many years, to the point where he ended up having to get a emergency resection. He went through ileostomy and all sorts of stuff. And I think that kind of, I thought it was a cool thing, very unfortunate for him, but it was very cool to kind of be there and, try and figure out what's going on with my detective skills, because I'm studying for the MCAT and maybe I can figure out what's wrong. Of course I was wrong, but it was still fun. So during that time too, I think it was my third year of medical school, maybe my fourth. So starting to look around for medical schools. At that point, I had no idea what the difference between an MD or a DO was. But I did know that there was a DO school that was in Tennessee that was actually pretty close to my undergrad in Knoxville. And they were doing an open house. It was at Lincoln Memorial, DeBusk College of Osteopathic Medicine up at the original campus in Harrogate. And I went up to their open house. I listened to what they had to say. They, told us, we're basically MDs. We just have this extra tool in the tool belt. They took us into the OMM lab and gave us some demonstrations of some of their techniques and walking through how this can help patients and how this makes you unique. And then also throwing the same info at you of you also learn cardio and GI and respiratory and all that other stuff. And ultimately, I thought it was super cool. So it came time to apply to medical school. I applied, pretty broad, but one of the first interviews I had was at DCOM, and I loved it. And when they offered me a spot, I just immediately took it and couldn't have been happier. I loved my time at DCOM. It was a great experience. And I think people that are interested in DO school should definitely consider there.
First of all, it's a great story. And I love, sometimes you just walk into a place and you click and you just say, this is where I belong. You mentioned when you were talking about the book that you did a teaching year. Was that an extra year? And how did you decide and why did you decide to do that?
I had always liked the idea. I mean, people, when they go to medical school, they say that, I want to help people, right? And I think one of the ways that I felt that I enjoyed helping people is helping teach or get across difficult concepts to someone who maybe didn't get a difficult concept. I think it's common for some DO schools, maybe most DO schools, to offer some sort of teaching fellowship or OMM fellowship or anatomy fellowship that you can do during medical school. And it's basically an additional year that you spend on campus. Some places have it broken between second and third years. Some are between 3 and 4. I kind of looked around. When you join this group, you actually join a national group of other predoctoral teaching fellows that are at other medical schools. So got to talk with them a little bit. But, I was always interested in teaching and helping others, and it just seemed like a cool opportunity to try out this new educational style for OMM. And I got to do something that I enjoyed, and I stayed around on campus where I was having a ton of fun with my friends, and it just kind of worked out.
Now, you picked up an MBA and another master's degree during that time. Can you tell us a little bit about that as well? Is that normal, first of all? And how the hell did you do that?
Lots of dedication, I guess. So during our fellowship, they do offer the option to pick up a master's of anatomical sciences, which was another perk of being in the program, is that you get to take additional courses and come out with a different degree. I think that most medical schools nowadays are trying to push the idea of getting some sort of business education into their students, because it's starting to become more and more important as you're seeing seasoned MDs and seasoned DOs going back to school to try and pick up an MBA. So my medical school happened to offer, a program to earn your MBA if a DO student was interested in doing it. And because I had, a little bit of extra time during the teaching fellowship, I went ahead and tried to do both. So I did both the MBA and both the master's in anatomical sciences during that year.
Yeah, I think the extra years, as you're pointing out, Jeremy, are very interesting, because if you take a step back, or maybe if you take a step forward and look at them, it seems like, okay, you're already doing 4 years of medical school. You're going to do a residency, maybe a fellowship, and maybe you have some debt or whatever you have. Like, does it make sense to do that extra year? And then you could say, well, maybe they give you some money or some credit towards your school if you do the year. I always think that, first of all, we interviewed David Elkowitz. It was like episode 5. I think it's one of the best episodes we've done. He's one of my favorite doctors. He was actually my mentor and the person that I think about the most as I went through med school. And he was an anatomy TA who ended up becoming a pathologist and then ultimately becoming a dean of an MD medical school, which is where he is now. And he wins like teaching attending of the year at an MD school as a DO every year, which is mind blowing. For me, again, I still, even knowing Dave, never thought I would do it. And then I ended up taking a chief resident year after I finished my residency. And listening to what you're saying, I think, there is that piece of giving something back and teaching. And I think you deserve a lot of respect for figuring all those things out so early in your career. And I think that's very cool.
Thank you. And I think it's, I'm one of those people that, I don't want to look back on something and think, oh, maybe I should have done that, or maybe I wished I had done that. And I think that life is all about having different experiences and picking up different traits and learning new things. And, the thing that I don't want to do in the future is have a job where, I show up, I leave, and it's the same thing over and over again. So if I can take, another year learning another skill, and maybe it can help me in the future, or I can, spend X number of months doing online education for an online education company and kind of mix up my daily routine a little bit, then it makes it a little bit more enjoyable for me. I certainly wouldn't do it if I didn't think that I would have fun doing it by any means, but absolutely not. I have no regrets about doing the teaching fellowship or working with online med ed or any of the other experiences that I've done. And I definitely encourage other people to, seek out doing something fun and doing something that you enjoy and picking up a new skill if that's something that's interesting to you, for sure.
All right, Jeremy. So you're doing all of these crazy things. You have an MBA, you have a master's, you're publishing a book. I know we didn't talk about it, but you're flying to Texas, right? You flew out. You told me to do these videos and help create the book. And then, you actually have to do medical school as well. And obviously you're spending a lot of time studying and trying to figure out what you want to do. So you decided you want to do internal medicine. How did you pick your residency, and tell us where you went to do your medicine training?
Sure. So I had always known that internal medicine was the route for me, mostly because I'm very interested in doing a GI fellowship in the future. I ultimately met my current fiance, who is going to be my wife in 2 weeks, I think, in medical school. So we ended up applying for the couples match. She did emergency medicine and I did internal medicine. And if you're trying to do couples match, you apply very broad and just kind of, go wherever, the algorithm kind of works for you. And it worked for us down in Baton Rouge. We've both been here for the past 3 years. We're going to be finishing up in 2 months. And we both really enjoyed our time down here. It's been a great learning experience. I would definitely encourage medical students who are applying to residency to try and go somewhere where you will see sick patients and you see a good volume of patients too. I think that's a very good practice for you to have, and being put out of your element a little bit and feeling a little bit uncomfortable, but knowing that you have a safety net with the attendings. I think it's a great experience. So Louisiana was one of the top ones on our list specifically for that. And we definitely got our good training in for sure, especially with, COVID hitting New Orleans and Baton Rouge really hard up front. So we had the additional benefit of training during a pandemic. But it's been a busy but enjoyable experience for sure.
So now a couple of questions about Baton Rouge, because I'm not that familiar with the center that you're at. Is it a big hospital? Do they have fellowship programs? Are there DOs there?
So there are 2 big hospital systems that are down here. One of them is Our Lady of the Lake, which is run through LSU. And then the other one is the Baton Rouge General, which does not have a medical school affiliate. Neither of them have in-house fellowships. Both of them have high acuity, high volume. The one at LSU is a level 1 trauma center where they have the emergency department residency that Macy is working at and she really enjoys. I'm doing the internal medicine residency over at the General, and it's at a level 2 facility. There are no fellows there, so you're thrown into the mix of it for everything. Including the ICU, which I thought has been a fantastic learning experience for sure, that other people maybe don't necessarily get to have, but I think it'll be something that'll help me out in the future when I'm in some critical situations.
Now, I know that you're looking for a GI fellowship and you're trying to figure out, you're finishing up your residency, you're figuring out what to do. Can you tell us a little bit about the application process and what it's been like for you and what your plans are for next year?
So GI is the ultra competitive specialty to apply for. So you apply very broad and you try and work very hard over X number of years to plead your case and show that you're interested and dedicated to the field. So over the past 3 years, I've gone to ACG every year. I've presented multiple cases. I've done research projects with other gastroenterologists that are in my hospital and then the hospital across the street as well. Application process is just like trying to apply for residency. So you go through ERAS and do the interviews, which was definitely interesting this year with everything being virtual. And then you wait around for match day and hope that things work out. With GI being so competitive, I think that the rate is pretty high for people that don't match on their first attempt, and I happen to fall within that group. So over the next year, I'm going to be continuing doing my research, continuing my talks with other GI attendings that I work closely with, and just prep up to reapply the following year. So I'll be moving out to Austin, Texas, and doing an internal medicine spot over there, while also continuing some GI work in the area. The nice part about Austin is that online med ed is mainly based out of there, so I don't have to travel back and forth anymore, which will be nice. And Austin's also a growing city with a ton of things to do, and it reminds me of being back home in Nashville, which is also a growing city with tons of things to do. So Macy and I are very excited for next year and moving out, getting our feet wet in medicine, and just enjoying it.
Jeremy, I think I mentioned to you that I myself applied twice for GI, and I have many friends who it took more than one shot to get into GI, just because although some people may say cardiology is a little more competitive, GI is, I think actually the most competitive medical subspecialty, specifically because of the number of people per spot. I think we have less spots than the cards guys do. But I have no doubt that you will be successful. I have no doubt, based on the story that you told me, that you're not going to give up and you're going to get your GI fellowship. And I think you've done so much in such a short period of time, and I'm really excited to see what you do in the future.
Well, I appreciate that. Thank you. And I'm excited to see how things grow and pan out for sure.
Jeremy, thank you so much for spending time with us tonight. I really appreciate everything. I appreciate everything you've done for the osteopathic community by writing the book. And again, I think you're going to be a great success and a leader for us in the future.
Well, thank you so much for the invite, Dr. Storch. I really enjoyed my time. I love listening to the podcast, and it's a great experience.
This concludes our episode of Do or Do Not. Send all inquiries, comments, suggestions, and even let us know if there's someone you want us to interview to doordonotpodcast@gmail.com. Don't forget to like us on Facebook at Do or Do Not Podcast for updates. If you enjoyed our podcast, please share it with your classmates and administration. We have plenty of more interviews lined up, and we're excited to share them with you. This is Tianyu Shea. Thank you guys so much for listening to Do or Do Not.